Obstetrics and Gynecology for 8th semester students of the Faculty of Medicine. Obstetrics and Gynecology. 1. Definition of obstetrics and gynecology. Obstetrics is a branch of medicine that studies the care and management of women's health during pregnancy, labor, and the postpartum period, as well as health issues that may arise during these stages. Gynecology, obstetrics and gynecology, focuses on medical and surgical care related to the female reproductive system, covering conditions such as menstrual disorders, infertility, reproductive organ diseases, and examination and management of childbirth. 2. Learning objectives. The learning objectives of obstetrics and gynecology in semester 8 are for students to understand the female reproductive cycle, from conception to menopause, be able to identify signs of pregnancy and manage the health of the mother and fetus during pregnancy, be able to manage and handle complications during pregnancy, labor, and postpartum, understand the medical and surgical procedures required in obstetrics and gynecology, understand contraception principles and family planning, be able to perform gynecological exams and manage reproductive disorders in women. 3. Main topics in obstetrics and gynecology. 3.1. Prenatal care, pregnancy examination. Physical examination of the pregnant woman, including weight, blood pressure, fundal height, and fetal heartbeat. Laboratory tests to assess the health of the mother and fetus, including blood tests, HB, blood type, immunization status, HIV test, and urine tests for protein, glucose, and infection. Ultrasound to monitor fetal development, fetal position, and detect structural abnormalities. Pregnancy trimesters. Trimester I, 0 to 12 weeks. Focus on early pregnancy detection, miscarriage risk, and initial examination. Trimester II, 13 to 26 weeks. Monitoring fetal development, further examination of the mother's condition, and detection of chromosomal abnormalities. Trimester III, 27 to 40 weeks. Intensive monitoring of the mother's and fetus's health as delivery approaches. 3.2. Pregnancy complications, preeclampsia and eclampsia. Blood pressure disorders that can lead to seizures and pose risks to the mother and fetus. Management includes blood pressure control and early delivery. Gestational diabetes. Diabetes that develops during pregnancy, which can affect the mother's and fetus's health. Management includes blood sugar control and close monitoring. Anemia in pregnancy. Hemoglobin deficiency that can affect fetal oxygenation. Iron supplementation and blood monitoring are critical. Infections during pregnancy, such as urinary tract infections or torch infections, toxoplasma, rubella, CMV, herpes, that can be risky for the fetus. Ectopic pregnancy. Pregnancy that occurs outside the uterus, often in the fallopian tube, which can threaten the mother's life if not addressed promptly. 3.3. Labor, partus, signs of labor. Students will learn about the early signs of labor, including contractions, cervical dilation, and physical changes in the mother. Labor stages. Stage 1. Cervical dilation until it reaches full dilation, 10 centimeters. This stage includes learning how to monitor the progress of labor and using medications to speed up labor if needed. Stage 2. Pushing and delivering the baby. Focus on techniques to assist the mother in delivering safely, including maternal positioning, baby delivery techniques, and cord management. Stage 3. Delivery of the placenta and monitoring for postpartum hemorrhage risks. Management of labor complications. Dystocia, difficult labor, often due to abnormal fetal position, which may require cesarean delivery or forceps vacuum assistance. Postpartum hemorrhage, PPH, bleeding after birth that needs to be managed immediately to prevent shock or maternal death. Cord prolapse, when the umbilical cord slips out ahead of the baby, which can disrupt fetal oxygenation. 3.4. Cesarean section and its indications. Cesarean surgery. A surgery performed when vaginal delivery is not possible due to indications such as breech presentation, premature rupture of membranes, placenta previa, or maternal health conditions, e.g. severe hypertension. Indications for cesarean section includes dystocia, preeclampsia, premature rupture of membranes, or maternal heart conditions that make vaginal delivery too risky. 3.5. Postpartum care. Mother's recovery after delivery. Monitoring the mother's condition post-delivery for early detection of complications such as hemorrhage, infection, and issues with uterine involution, returning to its normal size. Breastfeeding and care of the newborn. Teaching about the benefits of exclusive breastfeeding and proper breastfeeding techniques. Examining the newborn's health, including physical examination, Apgar score assessment, and administering initial immunizations. Postpartum contraception. Management of contraception after birth, including options such as IUD, birth control pills, or implants. 3.6. Gynecology. Gynecological examination includes physical examination, pelvic examination, Pap smear for early cervical cancer detection, and ultrasound for gynecological problems. Common gynecological disorders, irregular menstruation, causes and management, including hormonal imbalances or conditions such as polycystic ovary syndrome, PCOS. Infertility, diagnosis and therapy for couples struggling to conceive, including evaluation of fallopian tubes. Sperm and ovulation monitoring. Gynecological cancers, early detection and management of breast, cervical, and ovarian cancers. 3.7. Contraception and family planning, contraceptive methods. Explanation of various available contraceptive methods, such as hormonal contraceptives, pills, injections, implants, IUDs, and sterilization. Family planning. Education on choosing the appropriate method of contraception based on individual needs and health conditions. 4. Practical training and clinical practice. Obstetrics and Gynecology Practical Training. Students are trained to perform obstetric exams, such as pelvic exams, fetal assessments, and labor management techniques. Clinical rotations. Students will rotate through hospitals to observe and engage directly in obstetrics and gynecology care, including handling deliveries and managing complications. 5. Learning evaluation. Theory examinations. Testing knowledge of obstetrics, gynecology, and reproductive health, including aspects of anatomy, physiology, and related complications. Practical and clinical skill assessment. Assessing students' skills in physical examination, obstetric techniques, and labor management, as well as postpartum care. Case discussions. Discussion of real or hypothetical cases to analyze diagnosis, treatment indications, and therapy choices in obstetric and gynecology.